Hello, hello. I'm Hannah Heredia, a nutrition support dietitian from sunny Arizona. It's getting hotter and hotter here each day, so I'm not too mad at the stay-at-home orders here, but definitely missed out on meeting everyone at Aspen in Florida, but I'm so happy Aspen's letting us do this, so thank you so much, Aspen. For this abstract, I worked with my coworker and board-certified nutrition support pharmacist, Courtney Wood. I'm presenting today a case of a home infusion TPN patient who we observed had an allergy to IV multivitamins. As you know, multivitamin combinations are vital for patients receiving parenteral nutrition where the oral or enteral route is not feasible. The multivitamin preparation contains important oil-soluble and water-soluble vitamins in an aqueous solution. That's a fancy way of saying they are much needed and have to be added to the PN solution. And although it is rare, there are definitely potential allergic reactions which may cause issues to the skin, the central nervous system, ophthalmic issues, as well as symptoms of urticaria, which are red bumps or hives, shortness of breath, wheezing, and angioedema, so swelling of the lower layer of skin or tissue under the skin, or mucous membranes. Some of the patient's background. He's a 77-year-old male and admitted on service for an abdominal abscess. He had no known drug or food allergies. In the hospital, he did have an all-over body rash and was receiving IV diphenhydramine and cortisone cream in the hospital. These did not carry over to the home. And once he transitioned in the home, he reported a rash occurring all over his body. And we'll go into that in the next slide. After the first dose of TPN in the home, the rash he had in the hospital returned and the redness increased and he developed 2 lumps in the back of his throat. So extremely scary and significant. A pharmacist then reviewed the medication profile and found no new medications had been ordered and all current home medications the patient had prior to hospitalization, he had had no allergic reactions. The central line was then evaluated, changed, and ruled out as a cause since the rash the patient had was on his entire body, not just surrounding the central line. The patient was then seen by his physician who attributed the symptoms to an allergy from an IV antibiotic the patient had previously received during his hospital stay. The patient infused the TPN the next night and continued to have itching and scratching to the point he was bleeding, and this only occurred during the TPN infusion. He was then readmitted into the hospital to determine what part of the TPN may be causing the allergic reaction. Dextrose, amino acid, and electrolytes were infused with no issues. The multivitamins and trace elements were then reintroduced, and the patient immediately had a reaction of itching, rash, and scratching. After 48 hours without no IV multivitamin, the patient tolerated the formula with no allergic reactions. The patient received an oral multivitamin without any symptoms and was then cleared to discharge home. Although an allergic reaction to commercially available intravenous multivitamins is rare, providers should be aware of potential reactions when providing care for patients on home PN. In addition to continue the safe transition from hospital to home, information regarding tolerance or reaction should always be transferred from the hospital to the home care provider team. And now I'm going to sound like a daytime TV commercial. Side effects as defined on the product label may include dermatologic symptoms of rash, erythema, and pruritus. Contradictions include a known pre-existing hypervitaminosis or hypersensitivity, and the formulation may mask megaloblastic anemia. When a patient does exhibit this whole body rash, the nutrition support team and prescriber should rule out any potential allergies to the products in the formula, including the multivitamin and trace element products, along with any other drugs or solutions added to the formula. And that brings me to the conclusion. I'd like to thank you, Aspen. Would much rather present this while beachside in Florida, But this work is amazing too. And thank you all. If you need me, I'll be home till April 30th or longer.